All right, joining us now with a deeper look and expertise, Dr. Thomas Marron, oncologist and director of Early Phase Trials Unit at the Tisch Center Institute at Mount Sinai Hospital. Dr. Marron, thank you so much for joining us. I'm sure you just heard that part with Nancy. She's holding up the hot Cheetos, she's holding up the Twinkies, and you're saying, put it down, right? You're probably saying, put it down. But you study cancers. You have seen a clear connection between processed foods and cancer, obesity, you name it. What can you tell us about, how processed foods really do affect our bodies, and what exactly does it do?
So, I mean, the main issue is that we really need to focus on moderation and education, and hopefully that's what is going to come out of this. And this is really talking about both processed foods and also alcohol, which has been a big focus of the Surgeon General as of late. But one of the main issues with processed foods is that the processing and all of the chemicals that go into it make it very easy to consume a very large number of calories in a very short time. And sometimes you don't even feel full at the end of that. And so this is really leading to a variety of health problems, but most of them stem from obesity. So obesity is the second leading preventable cause of cancer. It's right after smoking, right before alcohol. And obesity, we're seeing more and more being related to the rising incidence of cancer, particularly in young people. We're seeing higher rates of breast cancer and colon cancer. And I think that there's, increasing evidence that that's related not only to obesity, but also a lot of the chemicals that are in these processed foods.
I mean, you see the stat we've got up there on the screen, 38% kids aged 12 to 19 pre-diabetic now. I mean, that is way too high, obviously, and you know that. Do you agree with the plans laid out by California Governor Gavin Newsom and RFK Jr. on highly regulating these processed or ultra-processed foods?
I mean, I'm not going to get into the politics of food regulation. I think, though, it is important to educate people. And I think that a lot of the times our packaging is not very educational. We don't really know what has high calories or low calories. I'm actually in Mexico City right now, and even the peanuts I got on the airplane said, this is a very high calorie content food. That's not something that we have in the United States. And so I think a lot of people just aren't aware of the number of calories that they're taking in, and also all the bad effects that come with processed foods and all the dyes and other chemicals that are involved.
Yeah, so you're saying education is key. I want to pivot to something else, to the health news this week. Just came out, the Surgeon General now saying that alcohol has been linked to 7 cancers, and soon a label could be slapped on your next bottle of wine or beer. The World Health Organization says there is no safe amount of alcohol. What are your studies finding about drinking as it relates or related to our health, and is there a link to cancers? We have this map up there for people.
Yeah, no, I think that we're seeing more and more evidence that cancer is very closely related to alcohol consumption. And, we have increasing data that not only is it related to head and neck cancer, which we've known for a very long time, that's mouth and throat cancer, but it's also related to all other sorts of gastrointestinal cancers and also breast cancer. So there's significant increased risk just by consuming even very moderate amounts of alcohol. So there was a recent study out of England that had over 200,000 folks that they were following, and they realized that even very moderate alcohol intake significantly increase the risk of cancer. So in the past, we used to say, 1 glass a day of wine for women and maybe 2 drinks for men would be a healthy idea. And also we thought that there were some cardiovascular benefits. It seems like A, the cardiovascular benefits aren't really panning out, and B, we're seeing really significant increase in the risk of cancer. So I think we need to, again, talk about education and moderation. And as doctors, we need to be discussing this with patients, because I think the majority of Americans don't realize that alcohol is in any way related to cancer risk.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.